Osteoarthritis is a joint disease where the protective cartilage that cushions the ends of your bones wears down over time. Think of cartilage as the body's shock absorber. It's a slippery, flexible tissue that covers the ends of bones in your joints, allowing them to glide smoothly against each other. When you walk, run, or dance, that cartilage is what keeps your bones from grinding together uncomfortably. In osteoarthritis, this crucial cushion starts to break down. But it's not just the cartilage that's affected. As the disease progresses, it can impact all the structures in the joint. The underlying bone may start to change shape, developing bony spurs. The joint lining, called the synovium, might become inflamed. Even the ligaments, those tough bands that hold the joint together, can become stiff and weak. Osteoarthritis is the most common form of arthritis, affecting millions of people around the globe. In the United States alone, it's estimated that over 32.5 million adults are living with osteoarthritis. That's about 1 in 7 adults. The prevalence of osteoarthritis increases with age. It's relatively uncommon in people under 45, but nearly everyone has at least some signs of it by the time they reach their 80s. However, it's important to note that osteoarthritis isn't just an old person's disease. It can affect people of all ages, even children in rare cases. Causes of osteoarthritis. Osteoarthritis is what we call a multifactorial disease, meaning there's usually more than one cause. One of the primary causes is wear and tear. As we use our joints over the years, the cartilage naturally experiences some degradation. It's like the tread on your car tires wearing down over time. This is why age is such a significant risk factor for osteoarthritis. But age isn't the only factor. Genetics play a role too. Some people are simply born with stronger, more durable cartilage, while others may have inherited genes that make their cartilage more susceptible to breakdown. If your parents or siblings have osteoarthritis, you're at a higher risk of developing it yourself. Weight is another crucial factor. Every extra pound you carry puts additional stress on your weight-bearing joints, like your knees and hips. It's estimated that every pound of excess weight adds about 4 pounds of extra pressure on your knees when you walk. So, if you're 10 pounds overweight, that's 40 extra pounds of pressure on your knees with every step. Previous joint injuries can also set the stage for osteoarthritis later in life. If you've had a sports injury, a car accident, or any other trauma to a joint, you're more likely to develop osteoarthritis in that joint in the future. This is why we often see osteoarthritis in former athletes or people with physically demanding jobs. Certain jobs that involve repetitive stress on particular joints can increase the risk too. For example, if your job requires you to kneel a lot, like if you're a carpet layer, you might be more prone to knee osteoarthritis. If you use your hands for repetitive tasks, like typing or playing an instrument, you might develop it in your finger joints. Symptoms of osteoarthritis. The main symptom of osteoarthritis is pain, but it's not always the sharp, sudden pain you might associate with an injury. Osteoarthritis pain often comes on gradually. It might start as a dull ache after using the affected joint, then progress to a more constant pain. Many people describe it as a deep, achy pain that gets worse with activity and better with rest. Stiffness is another common complaint. People with osteoarthritis often feel like their joints are stiff and hard to move, especially first thing in the morning or after sitting for a long time. This stiffness usually improves with movement, but it can take 30 minutes or more to really loosen up. As the condition progresses, you might notice a loss of flexibility in the affected joint. Tasks that were once easy, like bending down to tie your shoes or reaching up to get something from a high shelf, might become more challenging. Some people with osteoarthritis experience a grating sensation when they use the affected joint. This is called crepitus, and it's that crunchy feeling you might get when you bend your knees or flex your fingers. It's caused by the rough surfaces of the damaged cartilage rubbing against each other. In more advanced cases, the joint might swell up or feel warm to the touch. This happens when the body's inflammatory response kicks in, trying to repair the damage to the joint. Unfortunately, this inflammation can sometimes do more harm than good, further irritating the joint and causing more pain. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of osteoarthritis. To diagnose osteoarthritis, your doctor will ask about your symptoms, when they started, what makes them better or worse, and how they're impacting your daily life. They'll also want to know about your medical history, including any past injuries or family history of arthritis. Next comes the physical exam. Your doctor will look at the affected joint, checking for swelling, redness, and warmth. They'll gently move the joint to assess its range of motion and to see if there's any crepitus. While a doctor can often diagnose osteoarthritis based on symptoms and physical exam alone, they might order some tests to confirm the diagnosis or rule out other conditions. X-rays are the most common imaging test used for osteoarthritis. They can show narrowing of the joint space, which indicates cartilage loss, bone spurs, and changes in the shape of the bones. In some cases, your doctor might order more advanced imaging tests like magnetic resonance imaging or CT scans. These can provide more detailed images of the soft tissues in and around the joint, which can be helpful in complex cases or when planning treatment. Blood tests aren't typically used to diagnose osteoarthritis, but your doctor might order them to rule out other types of arthritis, like rheumatoid arthritis or gout, which can have similar symptoms but require different treatments. Treatment for osteoarthritis. Unfortunately, there's currently no cure for osteoarthritis. The damage to the cartilage can't be reversed. But the good news is that there are many ways to manage the symptoms and slow the progression of the disease. First up is exercise. I know when your joints hurt, exercise might be the last thing you want to do. But regular, moderate exercise is one of the best things you can do for osteoarthritis. It helps strengthen the muscles around the affected joint, which can take some of the pressure off the joint itself. Low-impact activities like swimming, cycling, or Tai Chi are often recommended. Weight management is another crucial aspect of treatment, especially for osteoarthritis in weight-bearing joints like the knees and hips. Losing even a small amount of weight can significantly reduce the stress on your joints and ease pain. Physical therapy can be incredibly helpful. A physical therapist can teach you exercises to improve flexibility and strength, and they might use techniques like ultrasound or electrical stimulation to help manage pain. When it comes to pain relief, there are several options. Over-the-counter pain relievers like acetaminophen or Tylenol are often the first line of defense. For more severe pain, nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen might be recommended. These can help with both pain and inflammation. For some people, topical treatments can provide relief. These might include creams or gels containing NSAIDs or capsaicin, which is derived from chili peppers and can help block pain signals. In more severe cases, your doctor might suggest stronger pain medications or corticosteroid injections directly into the affected joint. These injections can provide powerful but temporary relief from pain and inflammation. There are also some newer treatments that show promise. Hyaluronic acid injections, sometimes called gel injections, can help lubricate the joint and reduce pain. Platelet-rich plasma therapy, which uses a concentration of your own blood platelets to promote healing, is another option that's gaining popularity, although more research is needed to fully understand its effectiveness. For some people with severe osteoarthritis that doesn't respond to other treatments, surgery might be an option. This could involve procedures to realign bones or, in advanced cases, joint replacement surgery. But treatment for osteoarthritis isn't just about medical interventions. There are lots of things you can do at home to manage your symptoms. Using hot or cold packs can help relieve pain and stiffness. Assistive devices like canes, shoe inserts, or jar openers can make daily tasks easier and reduce stress on your joints. Some people also find relief with complementary therapies like acupuncture or massage. At the end, with the right combination of treatments and lifestyle changes, patients can manage their symptoms effectively and maintain an active, fulfilling life. It's all about finding what works best for you. Now, we want to hear from you. Do you or someone you know have osteoarthritis? What treatments have worked for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.